High cholesterol is a health condition where there's an excess of fats, known as lipids, in your bloodstream. This situation is also referred to as hyperlipidemia or hypercholesterolemia. Our bodies require a certain amount of lipids to work correctly. However, when there's an overload, the body can't utilize all of them. The surplus then begins to accumulate in your arteries, joining with other elements in your blood to create plaque, which are fatty deposits. For a long time, this plaque might not cause any noticeable issues. However, as time goes on, it continues to grow within the arteries, silently posing a significant risk. This gradual buildup is what makes untreated high cholesterol so perilous. The additional lipids in your bloodstream contribute to the growth of this plaque without your awareness. The only method to detect high cholesterol is through a specific blood examination. This test, known as a lipid panel, measures the levels of lipids in your blood. The threshold for what is considered high cholesterol varies depending on factors like your age, gender, and any history of heart disease. Remember, the information provided is for educational purposes only and should not substitute informed medical advice or care. Now, what is good cholesterol and bad cholesterol? How do they differ? There are different kinds of fats in our blood, but the two you're likely most familiar with are known as good cholesterol and bad cholesterol. Good cholesterol goes by the name high-density lipoprotein. You can remember H stands for helpful. HDLs are beneficial because they transport cholesterol to your liver, which then regulates your cholesterol levels. The liver produces the necessary amount of cholesterol for your body and disposes of any excess. It's important to have a sufficient amount of HDLs to move cholesterol to your liver. If your HDL levels are low, it means there's too much cholesterol floating in your bloodstream. On the other hand, bad cholesterol is referred to as low-density lipoprotein. LDL is the main reason plaque builds up in your arteries. If you have a high number of LDLs, you're at an increased risk of developing heart disease as time goes on. Now, what are the symptoms of high cholesterol? 1. Yellowish bumps around the eyes. Yellowish patches near the eyes, known as xanthelasma, might indicate elevated cholesterol. These patches result from cholesterol and fats gathering beneath the skin. While they're commonly found near the eyelids, they can also show up on other body areas like elbows, knees, and hands. For some, these patches are just a beauty issue, but they can also signal deeper health problems, including high cholesterol or issues with the liver. If you spot these yellowish patches around your eyes, it's crucial to consult a doctor to figure out the cause and get the right treatment. 2. Chest pain or angina. Feeling chest pain, often called angina, is a sign that might point to high cholesterol. This kind of pain happens when not enough oxygen gets to the heart muscle, leading to a sensation of tightness or squeezing in the chest area, which can also affect the shoulders, arms, neck, jaw, or back. Often brought on by exercise or stress, this pain typically eases off when you rest. It's important to know that angina is a serious issue and could be a precursor to a heart attack if ignored. Should you feel any chest discomfort, getting medical help right away is crucial. 3. Shortness of breath. Feeling out of breath can also be a sign of too much cholesterol. This happens because the cholesterol clogs up the arteries, making it hard for blood rich in oxygen to reach the lungs. This issue might stand out more when you're active or lying down. Being short of breath could point to bigger health problems, like issues with your heart or lungs. If you suddenly find it hard to breathe, or if it feels really bad, it's critical to get medical help right away. 4. Numbness or tingling in the hands or feet. Experiencing a lack of feeling or a prickling sensation in your hands or feet could indicate high cholesterol. This condition happens when cholesterol accumulates in your blood vessels, hindering the blood's flow to your limbs, which can harm your nerves and cause these sensations. Often you might notice it first in your fingers or toes, but it can affect your hands and feet too. If you start to feel these symptoms, it's crucial to see a doctor to figure out why it's happening and to discuss the best way to treat it. 5. Swollen feet or ankles. Having swollen ankles or feet might be a clue that your cholesterol is too high. This happens because the cholesterol clogs up your blood vessels, making it hard for blood to get down to your legs and feet, which causes swelling. You might notice this more after you've been standing or sitting for a long time, and it could feel heavy or uncomfortable. If you're dealing with swelling like this, it's really important to go see a doctor to figure out why it's happening and talk about how to take care of it. 6. Fatigue or weakness. Feeling unusually tired or weak could point to high cholesterol. This issue arises when cholesterol blocks your arteries, limiting the flow of blood to your muscles, which can make you feel drained or weak. You might notice this more when you're active or if you've been still for a long time. If you're facing these kinds of symptoms, it's crucial to get checked by a doctor to find out the reason and discuss the right way to treat it. It's important to remember that not everyone with high cholesterol will show signs of it. That's why keeping an eye on your cholesterol levels is key, especially for those with a family history of heart-related issues, people who are overweight, have high blood pressure or diabetes, smokers, or those who aren't very active. If you're dealing with any of these risk factors or symptoms, it's a good idea to have a chat with your doctor about checking your cholesterol. To wrap it up, the impact of high cholesterol can be severe, even if it doesn't always make itself known through symptoms. Regular checks and adopting healthier lifestyle habits are crucial steps. If you're at risk or notice any concerning signs, reaching out to your healthcare provider for a cholesterol test is a smart move.